Yes, how are you feeling?
I feel really gross and icky and sweaty, and I haven't been bathed or showered in like a couple days. Do you think it's time for me to have a bath?
No, I think you're fine. I'll just go get you some water.
I just want to let you know last night we checked on your patient and she is very sick because she hasn't been cleaned or bathed properly in the past couple days.
Okay, I'll get on that right now. It's important to tend to your patient's cleanliness in order to make them feel more comfortable and relieved in their bed, because just like Florence Nightingale said, it's poisoning by the skin is no less certain than poisoning by the mouth, so it's important to wash their clothes, bathe them by either sponging or like however the doctor ordered. So it's important to just clean your patient.
Nurse,
Yes.
I was wondering if you could give me a shower or a bath. I'm feeling really gross and just sweaty.
Okay, yeah, I'll go get you new fresh clothes and then we'll get you in the shower right away.
Okay, thank you.
How are you feeling today? Kind of stuffy and I can't really breathe as well in this air.
Okay, well, I just opened the door. How does the fresh air feel?
I don't really feel anything yet, so.
Okay, well, I think you'll start to feel the fresh air soon. Ventilation is one of the most important things that Florence Nightingale talks about in her book. One of the quotes is to keep the air he breathes as pure as the external air without chilling him. It's opening windows instead of opening doors. Opening doors lets in stagnant air, whereas if you opened a window, it will let in the pure air from outside and cleanse your patient. And also, in cities, the night air would be the purest. So in Chicago, that's relevant because at night, the air is pure because there's absence of smoke and noise. So ventilation is still important today because when you ventilate the room, it airs out moisture and sickness in the room, so it prevents your patient from getting any sickness that they could get from if you opened up the door instead of opening up the window. Okay, I'm opening up the window to let in some fresh air. How does that feel?
Very good.
Okay.
I'm starting to feel better.
Okay, I'll come back and check on you.
Hey, what's up?
Nurse.
I'm supposed to be checking on a patient right now, but I'll check her in like 5 minutes or so. But I get off at 8. What are we doing tonight?
Nurse.
Okay.
Help me.
Okay.
Help me, I'm poor.
Okay, cool. Sounds good. Okay, bye.
It is important for not only the charge nurse but other nurses to carry out proper medical procedures. Charge nurse needs to make sure that they know where their nurses are at all times and make sure that they're doing the right duties because the patient is important and you need to care for the patient. It is important to never neglect a patient because this is a workplace and not a social time.
Hello? I'm at work right now. I'm supposed to be checking. 1 second. I'm supposed to be checking on a patient right now, but I don't.
Excuse me, what are you doing? You're supposed to be attending to your patient, not be on the phone.
Sorry, it was just a quick phone call.
Make sure it doesn't happen again.
It won't.
Alright, you should just try and get some sleep right now because you've had a long day. It's been awake for a while, so just try and get to sleep.
Oh my God! Hey!
How's it going? Pretty well. Yeah, I had a date like last weekend. It went really awesome.
Oh my God,
that's so great. This is so cute. Yeah. Unnecessary noise should be kept from a patient because it prevents them from going to sleep and it creates unnecessary anticipation. Are you feeling alright? Alright, you should get some sleep. You've had a long day.
Hey.
Oh, hey, hold on. She's going to
I just want to let you know from the vacation last night we found out
Wait, what?
How does that fresh air feel?
Yeah, I'm leaving. No, you're stupid.
Although I have to go to the bathroom.
We're all making our pitches seem like they're retarded. I don't know what you're talking about.
Oh, it's still recording. Don't record it. You gotta practice.
Hey, you should probably just try and get some rest. You know, you've had a long day.
Right? You had a long day, right?